We are going to be recording this. If folks have to jump off, we'll be sending out the recordings so you can make sure you can finish the training. We're so happy to see you all here today. Thank you so much for attending. We're really looking forward to this session. Before we get going, just a couple of quick announcements. This training today will be in English, but we are next month on the 6th of July having the same training, but in Spanish. And I'm going to ask my colleague Peter to drop this link in the chat. So if you would prefer to take this training in Spanish or want to share it, please feel free to sign up with that link. Next, if you are new to NACHW, welcome. Thank you for coming. Just to give a bit of background, NACHW is a young organization. We're just 3 years old, and we came together with our founding board of directors of allies and community health workers across the country with a common shared vision to see community health workers united nationally to support communities in achieving health, equity, and social justice. We are first and foremost a membership organization. We invite your membership and hope to see many of you at our member events. Some of them benefits of membership are getting to connect with over 2,000 members across the country, getting a NACHW newsletter just for members, getting to access some of our document resource center, our COVID page, and so much else. You can find more information about that in our website. If you don't want to become a member yet, that's also fine. You can also sign up for a free newsletter also on our website to get updates about our events and more trainings just like this one. I also want to give a big shout out to our upcoming Unity Conference. This is a virtual conference that we hold each year for community health workers across the country. It's going to be August 3rd and 4th. We are right now accepting abstracts for presenters, several different awards you can nominate your peers for, and you can learn all about that at nachwaunity.org. We hope to see many of you there. This will be free for our CHW members, and registration is going to open in just a couple of weeks. I also want to give a brief shout out to a webinar we have coming up in a couple of weeks, which is going to be about a CHW toolkit. This is going to be about our Johnson & Johnson Race to Health Equity program, where we have a group of CHW leaders who are doing a series of capacity building webinars. This is the latest in the series, and we're really looking forward to folks getting to meet Andrea and hear about her toolkit. And once again, I'm going to ask my colleague Peter to drop that link in the chat. And welcome. I want to acknowledge we have so many people who are coming in. Thank you and welcome. Please feel free while you're getting settled to take our pre-survey and introduce yourself in the chat. I also want to give a shout out to our Learning Collaborative coming up at the end of June. We are going to be splitting into these different groups to talk about CHW career pathways. So if you're interested in that topic and want to meet community health workers working in these fields across the country, please feel free to register and join us then. I also want to give this exciting announcement that the ADA has actually given us 150 free CHW memberships. And we have a Google form where we will be raffling off those memberships to the folks who are here today. So I'm again going to ask Peter to throw that in the chat. I'll also be emailing out all of these resources after the webinar. So if you're not looking at the chat or you don't save a resource, don't worry about it. I will email it to you afterwards. That's all from me today. Other housekeeping items, we are recording this and we'll be sending out that recording. At the end of the training, we will be putting a post-presentation survey in the chat for folks to take to get our certificate. So please look out for that. I'll also be emailing that out. But without further ado, I am just absolutely delighted to get to pass this off to Mercedes Cruz, who has been our trainer and who has developed this focus on diabetes training that we're so excited about. So with that, I'm going to pass it off to Mercedes. Thank you so much for everything.
Well, good afternoon, everyone. How's everybody doing today? I'm in Texas, so how's the weather where you are? Yay, we're here. So yes, I'm a little bit I'm Cuban, so I'm a little bit of a firecracker. So let's begin. I want to thank everyone that it's, oh, I see California. So I'm going to share my screen, make sure everybody is watching my screen, making sure that you're seeing it. Let me put
Yes,
my
we can
presenter.
see it.
Okay, so good. So again, thank you for coming. As Aurora mentioned, it's focused on diabetes, but it's going to be a little bit more closer look at eye disease or eye health, related to diabetes. So I'm going to move. My name is Mercedes Cruz Ruiz. I am a actual state certified instructor of community health worker here in Texas, and I hold license number 134, which is a actually here it is a 2-year certification where I produce community health workers. I train them for 6 months, 160 hours. They graduate with a 2-year certification by the Department of State Health Services. I have been training for over 16 years, more than 1,700 classes to date. Like Aurora mentioned, we're being recorded. It'll take about 90 minutes. These are just some of our more housekeeping rules. If you can put your phone on silence, and if you can mute your microphone if you're not talking. I encourage participation, and we will have a couple of breaks where you're going to stretch and go eat, go to the bathroom, and then we'll have a 20-minute Q&A session. Now, I do want to give a disclaimer. The information that will be provided here in this presentation is only informational and educational purpose only, and does not substitute professional medical advice or consultation with healthcare professionals. Now, if you're new to Zoom, these are just going to be some of the things. If you wanted to, to raise your hand, or if you wanted to say, yay, you wanted to laugh or anything, use your reactions on your Zoom, and it looks like this. And then, of course, your chat, you already have been using it and muting your microphone. So that way we can have a good experience. So it's easy. If you can see here, it's easy to take care of your sight for granted. As a matter of fact, if you notice, I do wear glasses, right? So Focus on Diabetes is a multi-year initiative that brings together the American Diabetes Association and visionary partners from learning organization in vision care to increase awareness about diabetes and eye health. Why is this important? I am a person with diabetes, and we always want to put the person before the disease. So I'm not a diabetic. I'm a person with diabetes. I am a 5-stroke survivor, mini stroke survivor. My last one was February 23rd of 2022. And I do have calcification, which is massive calcium buildup in the major arteries, and that's why I have my mini strokes. I do have some minimal damages to nerves because of the strokes, but other than that, I am very functional, and I'm excited to be with you guys today. Now, one of the things about our PowerPoint, this was developed to be a toolkit, so there's a lot of handouts that go with them, and again, you can have access to the PowerPoint if you wanted, and there's embedded a lot of links so that you can access all the resources that we have provided. So remember, vision loss is preventable with early detection, timely treatment, and appropriate follow-up care. Now, we already did a little bit of getting to know you guys because you're already been putting some stuff in the chat, but throw in there how long you've been a community health worker, because we're going to save the chat and kind of see and tell us briefly what led you to this presentation. I would love to get some feedbacks about that. So if you can take some minutes, a minute to do that, I would appreciate it. I'll continue, but then I'll definitely come back and read those when we go over the chat, okay? Now, what are our objectives for today? Well, today we will focus on the following. So by the end of the training, you will be able to know what? You will be able to know the risk factors for diabetes. You will know the warning signs for diabetic eye disease. And you would also, okay, will take control of your eye health, okay? So that's my call to action. You know now, you're a person with diabetes, we're gonna need to do something about it. Now, Now, you are going to see that throughout this presentation, I am going to cover things in kind of, you say, why is she repeating herself? It's not repeating technically, statistical. Your brain is kind of finicky on what considers important or not. So technically, we have to repeat it a couple of times because an hour from now, you would have forgotten about 50% of what I'm already saying. And about 6 hours, you would have forgotten 75%. So the more we read, the more we go over a topic, the more we remember. Now, this is just some statistics. I'm not really going to go too much into it for this one, but just keep in mind, about 37 million people with that have diabetes. And again, about only 5%, 2 to 3 to 5% will be type 1. So mostly this number really represents type 2. And then if you look at the pre-diabetes, those that are kind of on the borderline of crossing from pre, that they can do a lot more to, diet and lifestyle change and kind of never end up being a person with diabetes, that are right there. So this is the perfect opportunity if someone you know or yourself are in that 96 million group, then this is the perfect opportunity to kind of take control. Why? Why is this important? Because if you can see on the chart, the numbers are skyrocketing. And by 2050, it's only going to get even worse. Okay, so it's important that we don't allow this projection of eye disease and impairment, vision impairment, continue to double year after year, especially not by 2015. You're like, we're only in 2022. But remember when we thought we were going into the 2000? Hey, the big change. Well, we're now in 2022. So a lot can happen when we were planning for 2020. 2020 came and gone. So now as we look into 2050, we got to make sure that that we change those, especially with impairment issues, meaning losing your sight. These are going to be also a little bit more, but if you can see, what I really want to focus here is, don't look at cataract, impaired glaucoma, or blind, or any of that, or macular degeneration. What I really want you to focus is on the topic today, diabetic retinopathy. Okay. And again, retinopathy meaning disease of the retina. So it's very important that we fully understand what goes on with our eyes. Okay. So is vision. So let's start with this question, because I have asked it and people kind of give me mixed feelings. So if you have an opportunity, drop this in the chat for me. And Aurora, if you can, capture the chat for me. Can someone answer the slide? Is vision loss part of getting older? Would you say yes? No? But know that so what do we have so far? Do we have more yeses than nos?
We have mostly yeses and some, it can be.
Okay, so this is good because today we're going to have some eye openings. So vision loss changes as we age, but vision loss and blindness are not part of normal aging. Now, did that surprise anyone? Why? I mean, what is normal vision changes? We need to ask ourselves. And that's what the next slide will cover for you. Now, although we are going to cover this topic during today's presentation, I wanted to share with you vision effects more than just the eyes. Okay, so what is vision changes are normal? Focusing on objects up close. When we're doing this, when we're watching, we're looking, and we kind of have to do it. That's normal as you age. Noticing that you need a little bit more light, that's normal. Losing vision and going blind, not necessarily. Okay, so please know that that is not going to be something that that is part of normal vision. Okay, now take care of your vision. Imagine for a moment not being able to see yourself as you put on makeup. Some of us, that's a daily thing, right? Mm-hmm. Reading a book, driving, dancing. Now you can walk with assisted equipment if you're blind, and maybe you can even dress yourself. But some of the other stuff, like driving, definitely you need your vision. So let's start by, focusing on how do we take care of our vision. And then for a person with diabetes, okay, they need to take even more care because they can develop diabetic eye disease. And now at this time, I am using the word diabetic because I'm not referring to a person, I'm referring to a disease or a thing per se. So let's start with, can anyone tell me what is the definition of a risk factor without Googling it? Okay, just tell me what your definition of a risk factor is. And then what do we got in the chat box?
I see smoking, genetics, habits, diet.
I like that. I'm going to stay with that one because I like those. That is correct. A risk factor is a behavior, something we do, okay? Or a condition, something that happens to us that increases a person's chances of developing a disease or injury, okay? So in the next slides, we're going to find out what risk factors, okay, affect the eye health when a person when we have a person that has diabetes. In other words, diabetic eye disease or diabetes. Okay. Now, many people have pre-diabetes or diabetes for years without knowing it because early symptoms can be so easily missed. It's not something that you're like, oh my God, I'm having diabetic eye disease. You don't really notice it. But if you can see in the slide, diabetes is the leading cause of vision loss from people 18 to 64, and there are no obvious sign that you can say and pinpoint it. Okay. Can somebody, yeah, if you can unmute, please. Now, what is the great news? The great news is that an annual routine eye exam. I'm sorry, someone can mute themselves, so it's kind of hard to hear for the rest of us. Okay, so like I was saying, with a routine eye exam once a year, you can prevent 95% of the vision loss that is caused by diabetes. How can we know if we got risk factors? Okay. Okay, sorry guys. Okay. Aurora, is there a way to mute all? Thank you. Please, if we can just go and mute all, that would be appreciated. Thank you so much. All right, like I was saying, 95% can be prevented with a single routine eye exam. Now, the great thing about the American Diabetes Association. Okay. Hold on. Okay, got it. I'm sorry, guys. We're trying to resolve the. My most sincere apologies, but it's hard for me to speak for you guys to understand when I have someone speaking in the background. That's going to make it harder for you guys to hear. And I am trying to use the mute all, but it's not working at this time. Okay, so I think we got a little bit of no feedback. So like I was saying, a routine eye exam will prevent 95% of vision loss caused by diabetes, but the ADA, the American Diabetes Association, created a awesome 60-second test that you can take to actually tell you if you have risk factor for developing eye disease. Can everyone look at the pictures? And if you can see, if you look at the picture right now, it says you are high risk for score of 6. Tell your health provider. All righty. So I think I was able to do that. Sorry. Okay. All righty. So if you can look at the PowerPoint slide, you can see that this is mine. This is my risk factor. I did it. And I'm going to walk you guys through it because I want you to go ahead and go to the ADA website. That's the link. After you do this training, take the risk factor and find out for yourself like I found out for myself. Okay. Now, this is going to be simple. It's only going to ask you questions and how old you are. Why is it going to ask you that? Okay. Because, you know, the older you are, the higher risk for type 2 diabetes. What gender? To tell you the truth, more men are likely than women to have undiagnosed diabetes. Why? Because they don't go to the doctor. Okay, that's why they want to know that. You know, you can see here, did you have gestational diabetes or did you have diabetes while you were pregnant? That's also going to put you at risk of developing diabetes as you get older. And then, do you have a family? Because that also going to put you at risk. Again, having high blood pressure contributes to your overall risk for type 2 diabetes. Being inactive, and when I mean active, I don't mean go to the gym and all that, just move, dance kind of thing. People of certain racial ethnic groups are more likely to develop type 2. I don't know if you remember at the beginning, but I am Cuban, so that makes me Latino or Hispanic. And so again, my mother had has diabetes. My grandmother had diabetes and she died of complications. And my father died of a massive heart attack, but we never did find out if he, and 44 years old, so we never did in Cuba, didn't know if he had diabetes too. So I come from a long line of risk factors for type 2 diabetes. Your height and your weight also can show. I am 5'1", and I am not ashamed to say I'm 183 pounds, but I used to be 270, but I took some control and lost some weight. And then at the end, if you say, email me my results, you actually get it emailed to you. So this is a great tool that ADA has. Now, not only does the ADA provide your risk score for developing type 2, but they also take it one step further, right? They're going to send you an email and going to follow up with you. And yes, you can even enter for a $100 gift card by answering. And this helps them develop better programs. And I'm going to walk you through that survey. Very simple. These are the questions they're yes and no. They're going to say, did you talk to your provider? They're just going to say, you know, are you on medication? How are you preventing diabetes and all that kind of stuff? They're also going to tell you, you know, to the best of your knowledge, what symptoms, and just going to ask you about, I think it's about 10 of the questions. They're going to ask you about true and false. And again, they're gathering data to better serve the population that has diabetes and develop new tools. So we're really helping them. It's going to talk about blurred vision. So just going to go through it. And as you can see, now let's talk about what we've been talking about, diabetes. And of course, as you can see here, diabetes is a chronic disease, right? In which the body does not make properly use insulin, a hormone that is needed to convert sugar, starches, and other food into energy. The brain, the body thrives on glucose because it's the best form of energy that we can have. But for a person with diabetes, that process doesn't quite get done. Now, very quickly in the chat, can anyone tell me the difference between chronic and acute? Okay. Now we know diabetes is a chronic disease, but can somebody give me another example of chronic disease and an example of an acute? And I'm just looking for 2 answers. And if Aurora, if you can help me in the chat with that, and then we can move on. And I see some happy faces out there because I'm looking at some of you. Very, very nice. And you know why I'm looking at you? Because I'll be calling on some of you. For something, and you're like, why is she going to call on me? I'll be calling on you. So
In the chat, folks are saying that are talking about chronic is a long-term versus acute, which is sort of short-term, such as a, you're shaking your head, Mercedes,
achoo.
such as a cold.
Exactly. That is perfect. That was the best answer that I was looking for. So thank you. We move on. Now, here the digestive organs, this is the written description of diabetes, but I have a video that's going to actually show it a little bit better. And give me a thumbs up if you guys are, and it's taking a little bit because let me see, why is it not? There we go. Let me know that you're seeing it and you're hearing it. Give me a thumbs up with your
Diabetes is a disease in which glucose, or sugar levels, are above normal in the blood. Most of the food we eat is turned into glucose that our bodies use for energy.
Let me make it bigger for you guys. There we go. Hold on.
The pancreas, an organ that lies near the stomach, makes a hormone called insulin that helps glucose get into the cells of our bodies. When you have diabetes, your body doesn't make enough insulin, or it can't use its own insulin as well as it should. This causes glucose to build up in your blood. There are several types of diabetes. In type 1 diabetes, the body does not make insulin. In type 2 diabetes, the body does not use insulin well and may not make enough insulin. This is the most common form of diabetes. Gestational diabetes happens when a woman's body does not use insulin well while she is pregnant. It raises her risk for type 2 diabetes and raises her child's risk of getting diabetes. Diabetes is serious. Over time, high blood glucose levels may cause many health problems, including heart disease, blindness, kidney failure, and foot sores and amputations.
Alrighty, so we're back. Thank you. I do apologize for the technical difficulty. I think when people were coming in, it kind of paused the video. So my apologies, but hey, we got 200 and something in our class today. So I am so excited for that. So we already covered what's diabetes. And again, you can have access to the PowerPoint and you can be able to replay that video for yourself. And remember, as a result of high levels of glucose buildup in the body, a spill into the urine and out of the body loses its main source of fuel and cells are deprived of glucose, a much needed resource. So remember, high blood glucose levels may result in short and long-term complications over time as you see it. So let's go into the path to understanding diabetes starts here. Now we cover a little bit of type 1, type 2, gestational. Now, although it's here, we won't cover very much diabetes, having diabetes from other forms, but some of those can be genetic mutations, and that's how people end up with diabetes that is not type 1, 2, gestational or pre-diabetes. So, but we're not going to cover those in our class today. So again, this is a short definition that you can see in written form as we saw in the video. And again, you can review it when you get the PowerPoint, okay? Now, so what affects my blood sugar? Well, things that can make your blood sugar rise is a meal or a snack with more food and carbohydrates than usual. You're not active, okay? This is what can make your sugar rise. Side effects of medication, yes. Infections and other illnesses. changes in hormone levels, going like me, going into, or changes in menstrual periods. And stress, if you work as much as I do, 12 to 14-hour days, then definitely stress can raise the sugar. But what can make your sugar drop, right? A meal snack less in fewer calories. Extra activity. You did a 4-hour walk instead of 30 minutes. Side effects of medication. You kind of skip a meal or a snack, and then drinking alcoholic beverages in an empty stomach can actually end up with low blood sugars. Okay, so now what do the numbers mean? And I have something to show you. I have a blood recipe that kind of give you an idea of what normal. Okay, so let's say I'm a person with diabetes. Normally I have a sensor. I haven't put it on today, but if I check my blood sugar and it says Mercedes is 100, what does that look like? I'm gonna show you, and I'm gonna wiggle it in front of you so you can see it. So look, if you did your blood, right? If you did your blood and it's normal, it should flow. I mean, it should be watery like in your arteries, right? But what happens? This is 100. But what happens if we just raise it to 200? And now if you look here, 6 is about 126. 6.5 is about 140. So this is 100. So this is below there, but this will be considered just checking your sugar and it's normal. So what you have here is an average, like a batting average. Sometimes you may get 180, but then the next time you get 100, then the next time you get 120, and you check your sugar for 3 months, right? And then when you add it all together and you divide it by all the days that you checked it, you end up with this percentage right here, because it's measuring percentages. Okay, now there is another thing called time in range that we will discuss in another training that we may update this one. They haven't come up with that data just yet, but they're working on it. But when you wake up in the morning and you check your sugar and you say normal, it should be 100 or less, right? But what if it's 200? Does that look to you like, what do you think you have in your blood? Literally, it looks like syrup like. That is just, if you see right here, 200. This is just a reading of 200 glucose versus the normal 100.
Do you want to come off screen share for a minute so they can see you better?
Oh, okay. Perfect. Yes.
Yeah.
Okay, there. How about now? Because I think that will be helpful. Thank you for that cue. Look at this. This should be your normal in the morning, the 100, right? This is just 200. Look at this. Imagine you're supposed to have oxygen and nutrients. Glucose is a nutrient. You should have oxygen in the blood. You shouldn't have cholesterol, triglycerides, another type of fat, and you shouldn't have syrup, which is this sugar. So again, we want to make sure that you keep those numbers in check, okay? Thank you, Aurora, for that, because I really wanted to show you that, so you can really put a visual. Now, what does the American Diabetes Association recommend? An A1C, or what we were talking about, the average to be less than 7, like you see in the PowerPoint, okay? Now, the closer you get to the target, the better chances of preventing or delaying problems from diabetes that can develop over time. Studies have actually shown that for every 1 point you decrease, right, in your A1C level, you reduce your risk of long-term diabetes complication by, hear me, 40%. That's amazing. So just going from that 7.5 to that 7.4 has meaning, but going from that 7.5 to 7 has an even better and greater benefit for you. So now, risk factor for type 2 diabetes. Of course, we talked a little bit, and you can see it here, your background, family background, your high blood pressure, your gestational diabetes, if you had any, if you're overweight, obesity. And again, sometimes it's not in this training. I do have several other trainings that talk about the difference between obesity and overweight. But in this case, it's obesity. A person is more than 30 pounds over the ideal weight, high cholesterol, and high triglycerides, which I talked about when I did my definition. Okay, so now risk factors. Are you 45 and older? I'm 52. Have a parent. We already talked about. Are you African American, Hispano, Asian, Pacific Islander? That puts you at greatest risk factor. Having diabetes while you were pregnant. Again, gestational diabetes. And remember, I mentioned at the beginning that we were going to repeat some things because we want to make sure that you keep as much info. It is a long training, so we want to make sure you retain as much as you can. Having a baby that weighed 9 pounds. Guess how much Mercedes weighed when she was born? I was a 10-pound baby. So none of my brothers actually ended up they're not type 2 diabetes, but I would venture that maybe my mother, when we were in Cuba, she developed type 2 diabetes, or gestational diabetes, and I kind of fed of a lot of sugar in the body. So again, okay, so just know that focus on those risk factors and make sure we reduce. Some of them you can't change, but some of them you can. Okay, risk factors also being told that your glucose, that remember, you're running numbers higher than that 100 at fasting, your blood pressure may be a little higher, your cholesterol, you sit all day, and and don't worry, I'm going to give you guys a break. In about 4 minutes, we're going to get up and we're actually going to stretch together, right? And some of you may need to go to the bathroom or drink water. We can do that, okay? And having blood vessel problems that affect the heart. Did anybody catch that I said that I have calcification in the arteries, which is massive buildup of calcium instead of in my bones, in my arteries, okay? So keep that in mind, okay? Now, another risk factor that nurses actually utilize this tool to kind of refer students to the doctor, to tell the parents to take the kids to the doctor. And this is what they use is, darkening, as you can see here, of the fingers and the knuckles, and then behind in the neck where it looks dirty, but it's not. This is a tool that the nurses utilize for this, okay? Now, let's talk the ABCs of diabetes. A, we already talked about it, your A1C, meaning that 2 to 3 months average of your glucose measure in a test to be lower than what? 7%, because that's what the ADA, the American Diabetes Association, has put as a standard. Now, your blood pressure, B for blood pressure, C for cholesterol. Now, we're really not going to talk a whole lot about cholesterol in this training per se, but again, keep that in mind, okay? Keep that in mind that cholesterol is also very important, okay? Now, keep in mind that high blood pressure does make your heart work too hard. So blood pressure, it's heart problems too. These are going to be some of your complications. If you can see here, retinopathy and blindness, neuropathy, nerve damage. I got some of that in my legs. Neuropathy. I'm sorry, my English is second language, so I gotta laugh. Kidney problems. Then there's ulceration and amputations, heart problems, of course, heart attack and stroke. And then for erectile dysfunction for men. And so it's very important that we talk about that, okay? Now, like heart attack and strokes, remember, like vision loss, heart attack and strokes are 80% preventable, okay? Now, if we already have problems with diabetes, if we're a person with diabetes, what should we do? What kind of treatment should we do? Okay, so this is what we can do. We got 7 self-care behaviors. Now, you're going to have a medical team, and we're going to talk about that because that will come a little later when we talk about the I team. But healthy eating, making healthy food choices, understanding portion sizing, learning the best time to eat are key to managing type 2 diabetes. And again, we're talking type 2 because, like we said at the beginning, type 1 usually happened at youth time, and it was something that affected the body that made the pancreas stop producing insulin. So most of these behaviors are going to be for what? Type 2, those that we have caused by behaviors, what we have done, or by, but throughout. Oh, there we go. It gave me a break, but I want to finish at least this slide before we take a stretching break. So again, being active, when I was mentioning before, being active, cleaning the house, dance around, walk. I walk in the mornings. If you can walk at night, I mean, all you need is 150 minutes a week, and that could look like anything. Or if you have a Fitbit, you know, if you got to work at home like me, you can walk around your house, come back every top of the hour. Now, everybody, time to get up and stretch a little bit. Or if you want to do it in your chair, you can stretch, okay? Or if you want, you can go to the bathroom. So I'm going to give you an opportunity to stretch for about 2 to 3 minutes, okay? And we'll come back. Alrighty, I actually took some time while we were on our break to actually look at our at their chat, and thank you so much. Some of you are sharing a lot of resources, and we're getting some great feedback. As far as everyone sharing with other people some of the resources and things, so keep that up. I like that that information. Alrighty, so let's continue to our next thing that we can look at. Okay, so I hope everybody's back, had an opportunity to stretch. Okay, so monitoring, daily self-monitoring of blood glucose, like you see here. Again, I usually wear a Freestyle Libre monitor that I just scan with my phone, but I haven't put a new sensor in. But I mean, it's great technology. Whichever way you use to a person can monitor their glucose is going to be very important to know whether they're going, you know, that they're really being effective as far as keeping their sugars within the normal range. If you can see it on your glucose monitor, sometimes you can see that it's very high. Some monitors will tell you it's very high. But one of the best, most important things will be monitoring and taking your medications. Okay, I have been, like I said, I've been teaching for a while, and I have some that said, hey, the first medicine they gave me was metformin, and it gives me side effects. I understand that, but again, talk to your doctor to make sure that you get the appropriate medication, so that your numbers stay within range. And again, medication, it's good, but also healthy eating. You cannot take medication and expect to have an A1C of just 7 all the time when your eating lifestyle, it's mostly sugar-based stuff instead of nutritional based, and there's no exercise, as exercise moves cholesterol. It also lowers sugar, so it's important. That's what we recommend, being active. Now, the last 4, it's going to be your smoking. A person that smokes, as you know, puts a person at 70% risk of developing a heart attack. And also, if you got all these nicotines and all these toxins that a cigarette has in your blood, then, you should have oxygen and nutrients and all those good stuff. So there are programs out there like the Quit Line that you can utilize to quit smoking. And again, problem solving. Why problem solving? Okay. Because you need to know what's causing your sugars. Okay. Are you eating more than you should? Are you skipping meals? What exactly is going on? What do I do? Like it says here, on my sick days, what do I do? When I'm stressed, kind of thing. So, problem solving and reducing risk is really going to be important. And then healthy coping. Okay. So if you're stressed or you're sick, if you're sick, don't go, okay, I'm already sick, I'm just going to eat this junk food right here because, kind of thing. Or you're really stressed and you're going to go for the ice cream. So again, that's what the problem solving and reducing skill and healthy coping will be with. So it's important to follow the simple 7 because the good news is type 2 diabetes can be what? Prevented or delayed with what? Modest weight loss. What are we talking about modest weight loss? Well, if we take a 200-pound person, right, and we ask them to lose 5 to 7% of their body weight, that means about 12 pounds, that can greatly increase, right, and reduce the risk for type 2 if they don't have diabetes. Okay, but even if they have diabetes, that kind of it can improve, the walking and feeling better and all that kind of stuff. So increasing physical activity, very important. Again, start walking 10 minutes, 5 minutes, and then sooner than later, you'll notice that you're walking 30 minutes like I am now every single morning and making those healthy food choices. I understand, it's kind of sad to say, oh, I can't really eat this or that. I don't really say that. Okay. I think of moderation. Okay. So if I'm at a party and I just want to, taste that little piece of cake, I may just take a spoonful. And this is just for myself. This is not advice for myself. And then I don't have that feeling, oh, I can't enjoy life because I'm a person with diabetes. No, I do. I just adhere to portions. Okay. So now we are getting ready. And remember when I said I was going to call on people? Guess who's first on my screen, right? Hello, Wanda. Miss Bell, how are you? I see you. I like your glasses. Are you ready? Are you ready? Okay, here you go. 5, 4, 3, 2, 1. All righty. What are normal vision changes as you get older? Give me one.
Needing more light.
You got it. You got it. You're right. All righty. Thank you so much for playing.
You're welcome.
All righty. So what do people with diabetes need to know? Let's talk about diabetes and eye complications. As covered in previous slides, diabetes can cause what? Diabetic eye disease, which can lead to what? Vision loss or complete blindness, right? So diabetic eye disease includes, these are going to be the 3 diseases that can be affected, okay? Diabetic retinopathy, cataract, and glaucoma. Now, so diabetic eye disease can cause permanent vision loss or low vision, which we will talk about in a couple more slides, right? So a person with diabetes is more likely to become blind than a person without diabetes. The risk for blindness may be lessened when risk factors are reduced. Remember those risk factors that we talked about? So remember, getting a dilated eye exam, like it says here, a yearly, not once every 2 years, yearly exam at least once a year is important to finding out diabetic eye disease. And also the eye exam, believe it or not, can also find out if you have never been tested for diabetes, if you have diabetes or if you have high blood pressure. There's a way a doctor can tell by the way the eye acts, or there's ruptured blood vessels in back of the eye that the doctor can tell you if a person that's never been diagnosed for both high blood pressure and diabetes could be diagnosed just with that dilated eye exam. Okay, so remember, managing your glucose is the greatest start for avoiding that diabetic retinopathy. Okay, so remember, vision is wonderful, but it could be lost if a person has diabetes. So to better understand vision, how about we take a look at the eye? Now, we're not really going to focus too much on this, but I did put it in here. I just wanted to kind of let you know, the cornea, it's, right here at the center of the eye, right here. I should say I should do my other screen right here, the cornea. And is the clear outer part of the eye focusing system located in front of the eye. Okay, so that's all we're going to say about that. Now, the macula, I do want to talk about the macula. The macula, because there's macular degeneration, which is a disease, and you're going to see it in a video we're going to show. So very much, the macula is the small sensible area of the retina that gives your central vision. It's located in the center of the retina. Okay, so that's all I'm going to cover on that. And we move on to the dilated eye exam. Now, don't wait until symptoms start to see an eye doctor, because remember, IDC doesn't always show symptoms. So by the time they show symptoms, there's already something wrong with it. Okay, so what is the dilated eye exam? Allows the eye care professional to optometrist or ophthalmologist to see more inside the eye. Now, the exam altogether, not just the dilated, may include the acute vision. They check to see if you can read far or read close, or it can say if you have myopia, in my case, near vision or far vision. Those are going to be called refractive errors, such as nearsightedness or farsightedness, and the shape of the eye, astigmatism. My apologies for that. It's a tongue twister, I tell you. They're also going to do that visual field test, which is they check your peripheral vision. When you're driving, you're like kind of be able to see here. So if you got good peripheral vision, you should be able to see your hands here. But as you start developing a disease, we're going to talk about in a little bit, you kind of start narrowing your vision to only this. And of course, it checks for eye muscle function to check problems with your muscles around the eyeball, the way you move your eyes. Okay. And then, of course, the pupil response test, where they put the light to see, if your pupil is moving. They also have another one that's tonometry to measure the pressure. They kind of throw a little puff of air inside your eye. And the last thing is a dilation. So let's look at a video. The good thing about this one is embedded, so I don't have to go out. And here we go. Let's take a trip inside the eye.
The comprehensive dilated eye exam, opening the door to preventing blindness. During a comprehensive dilated eye exam, the patient receives special eye drops that dilate the pupils. The pupils open wide, allowing the doctor to see the back of the eye clearly. With a better view of the back of the eye, the doctor can look for signs of the common eye diseases that can lead to blindness: glaucoma, diabetic retinopathy, and age-related macular degeneration. When eyes are dilated, the doctor can clearly see the retina, optic nerve, and the macula. This is the optic nerve. The doctor is looking for early signs of glaucoma. This patient's optic nerve is healthy, but here's what it would look like if it showed signs of glaucoma. The doctor will see changes in the shape or color of the optic nerve. The doctor may also see what is called cupping of the optic disc. Glaucoma is most common in African Americans over the age of 40, people over 60, and in people with a family history of glaucoma. In addition to the optic nerve, the doctor can also clearly see the retina at the back of the eye. The doctor might see signs of diabetic retinopathy. Early diabetic retinopathy starts with small red dots called microaneurysms, and can progress to leaking blood vessels, causing thickening of the retina and blurring of vision, or new blood vessel growth that can bleed and cause blindness. If you have diabetes, you are at risk for diabetic retinopathy. While still examining the retina, the doctor can also look for signs of age-related macular degeneration, or AMD. If this patient had AMD, the doctor would see yellow spots beneath the retina, called drusen, or dark clumps of pigment. AMD is the main cause of visual impairment and blindness in older Americans. Dilation enables doctors to get a better view of the back of the eye, which allows them to determine whether there are early symptoms of disease. But it's important to know that all people older than 60 need a comprehensive dilated eye exam each year and should inform their doctor right away if they begin to have problems with their sight. People at higher risk may need to have a dilated eye exam more often. Risk factors, including race, age, and family history, are all important to determine how often patients should receive a comprehensive dilated eye exam. To learn more about comprehensive dilated eye exams, common vision problems, and eye disease, visit www.
And I'm going to skip it. Next. Okay. Because if not, it loops around again. So who can develop diabetic retinopathy? Well, all persons with diabetes, both type 1 and 2, can develop diabetic retinopathy, the most common diabetic eye disease. The longer a person has diabetes, the more likely is that they will develop diabetic retinopathy. More than half of people with type 1 diabetes have some retinopathy after 10 years with diabetes. Almost 1/3 of people with type 2 have some retinopathy at the time they are diagnosed. Because again, by the time they go, remember when I was talking about men actually go to the doctor less than women do, so they tend to be diagnosed a lot later with type 2 diabetes. So, all righty. So now, and I love the fact that that the ADA, the American Diabetes Association, have these great tools, right? That you can check for risk factors. So here's the one that that you check to see if you're already at risk for retinopathy. So vision loss due to diabetes can be prevented with early detection. We already talked about that. Timely treatment and preventable lifestyle changes. And I know sometimes we don't like lifestyle changes, but we need to, because we need to live longer. But with this free, and the word free, I like it, Retina risk calculator, you can better understand the risk factor, calculate your risk, and learn simple steps you can take to prevent vision. So this one is not going to be like the first one that I walked you through each screen, because this one I'm just going to point to how it's going to take you. Okay. So basically, if you look at the bottom, okay, if you look at the bottom, it's going to say get started, right? Get started. And then, so you get started, and then it's going to ask you what language do you want? Type of diabetes. I mean, have you been diagnosed with type 1 or type 2 or none? You know, again, your gender, women, female. Diagnosis, have you ever gotten a diagnosis of actually eye disease? And then it's going to talk about a little bit about retinopathy. It's going to ask you your A1C. It's going to ask you your blood pressure, and then it's going to give you your results. And because this is an online risk test, it's kind of hard to go and show you, but I did it already, and I'm going to show you my result, okay? So here's my result. So this is what it said, okay? And again, it says I am at low risk for retinopathy, okay? Now my A1C is a little poor, okay? They would like me to get better on my A1C. I'm really working on it. And my blood pressure is a little elevated, okay? But again, all in all, because I go to the doctor, I get my dilated eye exam, I see my doctor every 3 months, I monitor, I get my medication, you know, my risks are low risk for retinopathy, and then you can email your result, or you can retake it. But I mean, if you answer the same thing, you should get exactly the same result. But this is a snapshot of what it gives you. This is what it gave me, okay? So I highly encourage anyone with diabetes to take the free test. It really, helps you and kind of recommits you to taking better control of your type 2 diabetes. Now, let's talk diabetic retinopathy, okay? Now, as you can see in this picture, okay, it's swollen vessels from this an eye swollen vessel. You kind of saw it a little bit on the video, but remember, it's an eye complication of diabetes, okay? It damages the small blood vessels and the retina, okay? The eyesight of a person with diabetic retinopathy can be damaged due to various causes. So we're talking bleeding, detachment of the retina, presence of abnormal blood vessels in the retina, okay? So all in all, remember, there are often no symptoms in the early stages of diabetic retinopathy. There is no pain and vision may not change until the disease has become severe. So if you look at the picture on top where it says normal vision, that's normal. That's what a person with good vision should be. But a person that already has developed and the disease is so aggressive that is showing signs now, okay, because of that bleeding and that detachment, okay, then the person is only seeing patches of the picture, okay? So you're like wondering, well, how is diabetic retinopathy treated? Well, vision loss can be prevented by finding and treating the disease in early ages. Treatment options include injections into the eye, laser surgery, as you can see in this slide, right? Which is a strong light beam aimed into the retina or removal of the vitreous gel. You're like, vitreous gel? We kind of saw it when we were looking at the eye, but I can tell you is that clear gel that maintains the shape of the eye and provides a clear space for light to go through to reach the retina. Okay, so laser surgery and appropriate follow-up care can reduce the risk, get this, by 95%. That's huge. That is huge because one of the things that we want to mention is that there are different ways that diabetic retinopathy can damage the eye, and that would be macular edema. This occurs when the weak blood vessels in the center of the retina leaks fluid within the macula. Now, you're like, we talked about the macula being the center part of the retina responsible for the straight ahead vision. Okay, so I'm looking at you guys straight ahead. Okay, now when there's vitreous bleeding, remember that gel that keeps the shape of the eye, fluid becomes cloudy by blood from damaged blood vessel. A person may need an eye operation to correct that error. So again, we're talking some serious issues from diabetic retinopathy. But remember when I mentioned that we were going to talk about low vision? What is low vision? What is low vision? It's a vision that is not corrected by eyeglasses, contact lenses, medication, and even surgery. Okay, treatment may not restore vision already lost to diabetic retinopathy. In this case, a person may have low vision. Okay, now a person with low vision may find it very difficult to do everyday tasks, even with glasses, even wearing contacts. Like I said, the good news is that vision rehabilitation can help people with low vision gain some independence because they're not seeing very well. Okay, so what is vision rehabilitation? Maybe utilizing some tools like the one you see right here, like this reader, right? And providing some stuff that they can take with them when they travel. So, and some other adaptive devices, and I'm going to show you some later on. But let's go into what causes low vision, okay? As you can see here, low vision occurs because of eye injuries or birth defects, but most people develop low vision by what? We talked about this, diabetic eye disease. So later in the presentation, we're going to cover cataract and glaucoma, okay? But let's talk about some signs of low vision, okay? So what are going to be signs of low vision? Even with regular glasses or contacts, a person has difficulty doing what? Recognizing a family member. I mean, they're not seeing them. It's a blur. They'll have trouble reading, cooking, picking out and matching colors, reading street signs. So driving may be very difficult for a person with low vision. Okay. What is a low vision assessment? Well, a low vision assessment, especially in low vision, now they have to be specialized in low vision, will assess the following: the general health and the eye history, functions of daily living related to their vision, their visual acuity, or any other eye function, and then they will recommend visual rehabilitation. Now, many people require more than just one visual device. And you're going to see some of those examples like the glasses, the telescopic lenses, special software for their computer, and other devices. Okay. And yes, trust me, I got another break coming up, but we're going to go about 35 more minutes and then we'll take a break. Now, these are going to be some of the devices. If you can see here, these glasses are not like my glasses, okay? These are very high power lenses, okay? Then of course, there's the magnifying glass that you may need to when you're out there shopping, or maybe you may need it to read your phone, okay? Then of course, there's the computer software. The telescopic lenses can either be put on your glasses just to magnify. You know, when I first saw these glasses, it reminded me of the coroner at the morgue in some shows that I have seen, that they wear one of these when they're looking at very, very, very tiny specimens in the body. So just FYI, I mean, just useless information, I guess, but I like to share. You know, we're chatting. It's not just training. We're chatting here, okay? We're a Mounds family. But guess what? Bobby, how are you, Bobby? Gay, you ready for me? Because I got a question for you. You ready? Here we go. Get ready to answer. 5, 4, 3, 2, 1. Here's your question. What do you believe causes diabetes? And you got, give me just one.
Genetics and lifestyle factors.
Thank you very much. Thank you very much. And we move on. So let's cover diabetes and cataract. Okay. So cataract is a clouding, just like you see here in the picture. Clouding of the lens in the eye that affects vision. Symptoms that can appear to indicate cataract include, of course, that cloudy or blurry vision, faded colors. You know, it's no longer a true red, actually, like my wall. My wall through your lens might look orange, but it's actually red, okay? So it's not something wrong with your vision. It's just the way the computer pigmentation is. Double vision, poor vision at night, problems with bright light, especially at night. So diabetes increases the risk for cataract, okay? Now, cataract can either occur in one eye or in both eyes, okay? But it cannot spread from one eye to the other. So people are like, okay, I got it in this eye. Is it contagious and going to come? It's not. In earlier stages, cataracts, okay, it's not yet visible. An eye exam is necessary for the detection. Symptoms of early cataract may be improved with new eyeglasses, brighter lights, like I would put better lighting in here, anti-glare sunglasses, and magnifying glasses. In these measures do not help. Surgery is the only effective treatment. Cataract surgery is usually safe, successful. The cloudy lens is replaced with a plastic lens, and now the person can actually stop seeing cloudy, and it goes from this wonderful picture of the boys to the, you know, it goes from the blurry picture of the boys to back to normal picture. Cataract, it's common all over the world, okay? So let's talk diabetes and glaucoma. Glaucoma is a group of diseases that can damage the optic nerves and result in vision loss and blindness. Now, unlike normal aging does not cause vision loss or blindness, glaucoma will do that. Retinopathy can do that, okay? So glaucoma may be caused by an increase in eye pressure. Remember when I was talking to you guys about when you go to the doctor, when they do that puff of eye in your eye to measure pressure? That's what it is. They want to measure the pressure in your eye. However, In some forms of glaucoma, eye pressure is normal. So that's why you got to get more testing than just that pressure. That's why you're going to get on your eye exam, you're going to get all these other things that they're going to do to complete a diagnosis. Okay. A form of the disease called open angle glaucoma and is diagnosed most often in the family groups. African Americans age 40 and older, everyone over 60, and again, Hispanics, people with family history of glaucoma, as we saw in the video. And again, you know me. Why is Mercedes repeating herself? Because it's been an hours and be in training. So about 50% is already lost, but we're going to recuperate it as we talk about it again. Okay. Now, people may not realize they have glaucoma until the disease is advanced. In the early stages, it is often no signs because one eye, if it's happening in the left, at the right eye, then the left eye will compensate and help out and balance the vision. But in time, vision loss to glaucoma cannot be restored. Okay. However, in early detection and treatment, vision loss may be prevented, or at least they slow down the progression of glaucoma. Okay. Now, treatment option from glaucoma includes what? Medications, eye drops, and also surgery. Don't worry, we're going to give you a break. So here we go. Let me introduce you to the eye healthcare team. Okay. These are going to be health professionals who are part of the eye healthcare team. And guess who's on the list, guys? We are promotoras. We are part of that healthcare team. Whether you call yourself a community health worker, a promotora de salud, or a health promoter, we are part of that eye health team. Okay, this team can be smaller or larger depending on a person's need. All these people can help a person with diabetes obtain optimal health, but the person with diabetes has the main responsibility by controlling his or her glucose levels and getting that dilated eye exam at least once a year. People with diabetes should know the following. They can take action to protect their vision. Everyone with diabetes should visit the eye professional at least once a year. An annual visit for the eye care professional can help or prevent blindness. And that's really what our tagline should be. Has anybody ever developed their elevator speech about what they do in their job? So when we're talking eye health, right? That should be an elevator speech. To avoid diabetic retinopathy, get your yearly dilated eye exam. Boom, and we're done. Our elevator speech for promoting eye health. So what can someone do to protect their vision? Well, let's summarize what we have learned about diabetes and eye health so far. Keep in track with diabetes. T stands for take your medication as provided by your doctor. R, reach and maintain a healthy weight. Don't do the yo-yo dieting. Dieting, that when we have a lot of this out there, it doesn't really help. We want to maintain, healthy weight, and even in weight loss, it needs to be a healthy weight loss per week. Okay, control your ABCs. Remember your A1C, your blood pressure, and your cholesterol. Okay, and of course, kick the habit of smoking. And again, I want to mention again, there is a quit line that provides not only some tools for you to quit, but they also provide patches or gums if you need them. Okay, let's move into diabetes and high blood pressure. Okay, managing high blood pressure with diabetes. 2 out of 3 people with diabetes report having high blood pressure or taking medication for high blood pressure. High blood pressure is a serious condition that won't go away without treatment. We all have blood pressure, but we don't all have to have high blood pressure. Okay, remember, blood pressure is the force of the blood against arteries of the wall as the heart pumps throughout the body. Side note, your heart beats about 100,000 times, and in pumping power, it has a pumping power of 2,000 gallons of blood. Not that you have 2,000 gallons of blood, you only have 5 liters, but I said the pumping power, meaning how hard it works. So remember, blood pressure helps oxygenated blood go from the heart to the body, to the brain, and back to the heart, and so on throughout the day. So Here, something we already talked about, high blood pressure means that the heart must pump harder than normal for blood to get to parts of the body. I often say, imagine the heart pumping blood pressure normal as walking, chill, right? Versus a person running, the heart has to do it a lot faster, just as you run. So in the previous slide, remember we talked about us having blood pressure. However, what we do not need, again, it's high blood pressure because it really causes heart problem. Oftentimes people say, I don't have heart problem. And I'm like, but you have high blood pressure. Okay, and the longer and harder the heart has to work to pump blood, the more damage you're causing to the heart. So again, what causes high blood pressure? Several conditions and behaviors can lead to high blood pressure. Sometimes high blood pressure is caused by another medical condition, such as kidney or lung disease. But remember, 1 out of 5 people with high blood pressure don't even know they have it. Initially, it can quietly, remember the silent killer, the lungs, the heart, the blood vessels, the brain, the kidneys, if left untreated. It is the major risk factor for strokes and heart attacks in the US. And as we look at the slide, you can see red for danger, yellow for caution, and green, you're in a safe zone. What are going to be those factors? Come on, even bread is going to be a fact. Even the salt in bread, if you can see here, cold cuts, pizza, sandwiches. So pretty much everything will have salt because it's a preservative. Just like a lot of things have sugar because it's also a preservative. But if you can look at the list, the things that have a red asterisk, it's things you control. That means you are in control of those things. You can't change your race. You definitely can't change your age, and you can't change your family history. I can't change the fact that I have had all those medical issues, okay? But you most definitely can take that. Now, the American Heart Association says that the most you need in salt in a day, okay, versus the federal standards or the US standards for sodium or salt. American Heart will like you to cut it to 15 milligrams, okay, which is really half a teaspoon. You know how little a teaspoon is? Cut it in half. And then for the standard, the US standard is 2,300 milligrams, which is a full teaspoon. But if you eat low on salt, then you can live longer without developing high blood pressure. So these are going to be some tips for you to throw some things in there. Okay, spice it up. Don't salt it up. I gave you some examples for carrots, squash. I even throw in some tofu if you are vegetarian or vegan. You know how to season tofu. And of course, our major sources of protein, meat, poultry, and fish. Okay. So in previous slides, we talked about the major contributors, right, for raising blood pressure. So again, don't forget that to do less fat, less salt, but also don't forget to do less fat, okay? Because most people with saturated and trans fat play a higher significant role in increasing your blood cholesterol, resulting in increased heart disease, but also with problems with diabetes, okay? So you can make your mealtime tasty by using all the spices and herbs that I have shared with you today, okay? And these are only some examples. This is not an exhaustive list by any means. But let's talk about proper blood pressure, because guess what? Sometimes your blood pressure is being taken incorrectly. You go to the doctor, they sit you on that gurney or that examining table, your legs are dangling. They're trying to put a blood pressure. Your back is not supported. They're talking to you while they're taking blood pressure. And those, according to the American Heart Association and the Diabetes Association, those are going to give you higher than normal readings. Just like if you haven't gone to the bathroom and you got a full bladder, okay? So these are going to be normal blood pressure. And it's funny because we always say 120/80 is normal for a person that does not have high blood pressure. Because again, if you have high blood pressure, your doctor might say that, you know, with 130/80, that may be a normal for you. But again, always talk to your doctor and kind of establish what your but your normal range is. But normal range is not 120/80. It's 119/79. Less than 120, less than 80. Okay. So remember, in conclusion, the top number shows the pressure and the pressure of the heart. The bottom number shows in between heartbeats when the heart is filling back with blood. But because we're visual people, we're going to take a stroll. This is what 110 looks like. You're just chilling, stretching, relax. About 130, there's that referee blowing the whistle saying, okay, we got issues. We got issues coming up. Okay. So in 2019, and I know that was, that was just 3 years ago, but just to give you a statistic, more than 500,000 deaths in the US, the United States had hypertension as a primary or contributor for the death. Nearly half of adults in the US, about 47% of 116 million, have hypertension, defined as systolic, the top number, right, as 130, and diastolic, the bottom number, of 80, and are taking medication for high blood pressure. Okay. If their blood pressure is consistently above the normal level, okay, falling anywhere between 120 and 139 for systolic pressure, the top number, or 80 to 89 diastolic pressure, which is the bottom number, then that puts that person at a greater risk of developing heart disease, okay, the longer they stay in those numbers. So the doctor may recommend serious lifestyle changes to lower blood pressure or more medication. But about 140, just like you see here, this tea kettle, it's about to burst. It is already beeping that there's something about to happen, some explosion that's going to happen. Not that your body's going to explode, but you're going into crisis. Okay, so high blood pressure in reading average for a 140/90. Remember that systolic and diastolic or higher for either number, okay, may still have no symptoms at 140/90. At 180/110 and higher, it's considered hypertensive crisis. A person may need to rest for a few minutes and take that blood pressure again. If it's still very high, 911. A hypertensive crisis can lead to what? A stroke, either a mini stroke or a bleeding stroke. In other words, a TA or a schematic stroke or a hemorrhage stroke. I have had 5 TAs, 5 ischemic strokes, not a bleeding stroke. Okay, symptoms of hypertensive crisis can include severe headache, anxiety, nosebleeds, and feeling short of breath. So let's talk about the signs of high blood pressure, because people sometimes says, well, there is no signs. They are. The problem is that 9 out of 10 times what we do is we associate it with something else. If you had 14-hour days and you're tired, but you're a person with high blood pressure, you didn't take your medication, it could be, and you're dizzy, it could be your blood pressure. But people are going to say, oh no, I work 14-hour days, or, or that headache I have is from all this tension, but it could very well be from high blood pressure. Okay. So, many people have high blood pressure for years without knowing it. Okay. Now, again, would you associate upset stomach with high blood pressure? Because I wouldn't have even thought about it, right? But okay, so most people ignore signs like this as normal every day is related to not sleeping. For some people, not sleeping is normal. No. Do you have anxiety? Do you have headache? Is there confusion? Because then maybe if you've never been diagnosed with high blood pressure, maybe it's time to go see. There's some things that happen to our bodies that are not normal, especially pain. Pain signifies something is not normal, okay? Now, for some people, the first warning sign that there's something wrong with them with high blood pressure is just that blood pressure reading that they may take at the doctor's office, or they may do at an event, a health fair, or any other place that they can check their blood pressure. Okay. All righty. Now, to know, up to age 45, more men have high blood pressure than women. However, when a woman reaches 65, a woman will tend to have more high blood pressure than men. Who would have thought that? So the greater the risk is if close family member has high blood pressure or a person has diabetes. So about 60% of people with diabetes already have high blood pressure. And think about this, 60% is a huge percentage. Okay, so again, why is that high blood pressure harmful? Remember, as we cover in slide number 64, and you may not, and you're not seeing the numbers, but I'm keeping track of them. Okay, a heart that is forced to work harder than number for a long time can do what? It would enlarge. Now, we all know your heart is about the size of your wrist, sits 3/4 sits on this side, on the left side, 1/4 sits on the right side, right? And it sits on a cavity, a special size cavity. And you cannot, and once it gets too big, right? Then the heart may not have the capability to keep pumping anymore because it may not have expansion to be able to pump, receive, pump, receive. So don't forget, high blood pressure can damage what? The eye if left untreated too. So let's take a look at what a normal heart should look like. You see it right here? You see it? I don't know if it's your right or your left. I can't tell because I'm just seeing it on one side. But if you look at this side for me, you'll see normal size of a heart. But then when you get an enlarged heart, that's what it should look like. This is a real x-ray, okay? Now, talking about a real x-ray, let's look at real problems and complications from blood pressure, okay? Here you go. Now, as you can see, high blood pressure has some of the same complications as what? Diabetes. However, let's just focus on the vision loss, okay? High blood pressure, or HBP as abbreviated, can harm your eyesight in many ways. The eye contains many tiny blood vessels, as you saw in the video. When subjected to long-term effect of high blood pressure, the following conditions can develop, okay? Blood vessel damage, retinopathy, okay? And we already talked about that. Fluid buildup under the retina, okay? This buildup of fluid on the retina, the light-sensitive layer of tissue in the back of the eyeball, result in distorted vision, in some cases, scarring that impairs vision. And then, of course, nerve damage, optic neuropathy, okay? The result of block blood flow that damages the optic nerve. It can kill nerve cells in your eyes, which can cause what? Temporary or permanent blindness by that nerve damage. So what can you do? Control your blood pressure to avoid complications, because outside of vision, again, you can have heart failure, which is, buildup of fluid. It could be, one of the signs could be buildup of fluid in the legs, and that's a sign of it. And again, your salt that's causing your blood pressure, that stroke, sexual dysfunction, both male and female, and of course, renal failure or kidney disease. So we want to be able to avoid that. And next, we have another video. This video is going to show you how to properly measure blood pressure by the American Diabetes Association. So us CHWs that take blood pressure out there, we need to follow the same guidelines when we're taking blood pressure of our community members, patients, etc.
Self-measured blood pressure monitoring is important and needs to be done correctly so it can be used to help improve your health. Let's review the basics. Self-measured blood pressure monitoring is when you measure your blood pressure while not at your doctor's office or another healthcare setting. Self-monitoring will help your care team gain a more complete picture of your blood pressure over time. This is most commonly done at home. The American Heart Association and American Medical Association recommend using an automated, validated device with an upper arm cuff. and preferably one with memory that stores at least 30 blood pressure readings. If you're unsure, ask your doctor or pharmacist for advice. Typically, you can measure your blood pressure with just a push of a button. Make sure the cuff you're using is the right size and fits properly. If you are not sure, ask your care team. Many factors affect blood pressure results, so it is critical you follow how to properly self-measure. Watch this video closely. If you have any questions, ask your care team for help before getting started. Let's review, step by step, how to properly self-measure your blood pressure. First, be prepared. You will be taking your blood pressure twice each morning and twice each evening. If you take blood pressure medication, measure your blood pressure before you take your medication. Prior to measuring your blood pressure, make sure you empty your bladder and avoid exercise, caffeine, and tobacco for at least 30 minutes before getting started. Find a quiet space without distractions. Second, get in the right position. Sit with your back supported and do not cross your legs or ankles. Have your feet flat on the floor. If your feet don't reach, place them on a stool or other object so they are supported. Rest the arm you will use to measure your blood pressure on a firm, flat surface at roughly the level of your heart, which is about mid-chest. Have the palm of the hand of that arm face up to relax all of the muscles in the arm. Place the blood pressure cuff on your bare upper arm so that the bottom of the cuff is just above the elbow. Once you are positioned properly, rest quietly for 5 minutes before taking the first measurement. Third, while measuring your blood pressure, do your best to make sure the room stays quiet and avoid talking with anyone, watching or listening to TV, and using the phone or other electronics. Perform your first measurement. When completed, write down your blood pressure numbers and your pulse that are displayed on your device. Wait 1 minute. Then repeat for your second blood pressure measurement. Write down your second blood pressure numbers and your pulse. Your care team may give you a form to use to write down all of your blood pressure measurements and pulse. Continue your self-measured blood pressure monitoring routine according to the instructions given to you by your care team. Report your blood pressure results to your doctor's office in a timely fashion. And be prepared to discuss results and take action if needed based on the information you provide. Self-measured blood pressure monitoring is a great way for your healthcare provider to get a more complete picture of your blood pressure. For confirming a diagnosis, assessing blood pressure control after changes in treatment, and monitoring blood pressure control over long periods of time. Remember, you play an important role in ensuring the results your physician or healthcare team receives are accurate. With accurate information, your care team can come up with the best treatment plan for you to improve control of your.
All righty. So I got to skip it a couple of times so it can stop. So as you can see here, yes, we have the control to prevent and treat high blood pressure. So that's a big news. That's definitely big news. And guess what is coming? All righty. So here we go. Claudia. And I can't pronounce your last name, but Hincapié? Did I do it right?
Yes.
Perfect. Okay, you ready?
Yes.
I know. Okay, there we go. What are the systolic?
Yes.
All righty. Thank you. And what's the bottom one?
Yes, Polly.
Thank you. These are just review questions. All righty. Perfect. Thank you so much, Claudia.
You're welcome.
All righty. All righty. So now let's talk about what nutritional stuff we need for not only for diabetes, but also for the eyes. Okay. So take care of your health. Protecting your overall health can go a long way towards keeping the eyes healthy. It is important to make healthy choices and take good care of yourself. Keep in mind that healthy habits like eating well and being active can lower what? Your risk for diseases and conditions that can lead to what? Eye problems, vision problems like diabetes and high blood pressure. Okay, so eating healthy, be sure to have plenty of what? Dark leafy greens like spinach, kale, collard greens. Now, I got to give my 2 cents input on that one. Make sure that the spinach I mean, even the broccoli, things like broccoli, collard greens, that they're not swimming in fat, or the broccoli is not swimming in cheese. We want to make the vegetables as healthy as they can, so they can assist you, as they have fiber that can move cholesterol and lower sugar. Okay, get active. Being physically active helps you stay healthy. It can also lower what? Risk health conditions that can cause eye health problems, and again, diabetes and high blood pressure. And then we already talked about that, quitting smoking. And I still got that 1-800 quit now hotline for you. Now, but the American Diabetes Association has a great little handout, and it's part of your toolkit. Some of the handouts for this, believe it or not, the toolkit for this training has close to 64 handouts in the toolkit. Okay, so that you can utilize with this presentation, whichever way you want. So it's important. I mean, I love the diabetes plate method because it's the easiest way to create healthy meals that can help manage blood sugar. Now, again, we all we have dietitians, and we got nutritionists and diabetes health educators among us. But again, something easy that you can put in the hands of your patients or family member. This is something that is part of the toolkit that you can get and share with them. Okay, because using the method, a person can create portion meals with a healthy balance of vegetable, proteins, and carbohydrate. All they really need is a plate. Now, the plate, 9 inches, okay? Then fill half of the plate with non-starchy vegetable. Okay, what are going to be those non-starchy vegetables that are going to be lower in carbohydrate, so that they don't raise that blood sugar very much? They are also high in vitamins, minerals, fiber, making them an important part of a healthy diet. Filling half the plate with non-starchy vegetable means that a person will get plenty of servings of what? Superfoods. Okay, so what are going to be some of those examples? Asparagus, broccoli, celery, cucumber. I love cucumber. Mushrooms. Okay, so that's just some examples. Now, we kind of talk about measuring, because portion size and all that kind of stuff. But I'll tell you, you can really utilize your fist to measure and your hands to measure a lot of things. And this is part of that this is part of the first slide we talked about. It's kind of a 3-page PDF. Okay, and it's going to tell you what they in green eat often, what they can eat sometimes. Remember that traffic light: green for go, yellow, orange. I guess here it's for whoa, and red is, it's for caution, and then red is for whoa, stop. Okay, so so it's very important to have some kind of tool that they can utilize. So if a person doesn't have a food label, or they don't have measuring cups, then there are ways a person can still gauge how much they're eating or consuming, if they use kind of this. So, let's practice. This is going to be the front of your fist. That's kind of going to be like half a cup. If you do the full fist, that's about a cup. If you do this, that's going to be about 3 ounces. If you do the thumb, sorry, I can't really close this one because of problems with my hand. So this is going to be right here. It's going to be a tablespoon. This is going to be a teaspoon. And then definitely the little cup that you do with your hand, that could also be, that's can also be an ounce for snacks. Okay, so again, great tools that you can utilize to assist those. And again, we put a lot of handouts in the toolkit. Now, protect your eyes. Everyday simple steps can be taken to keep the eyes healthy. Tips to protect the eyes from things that can harm you. Protect your eyes, again, from the sun by wearing sunglasses. Even a cloudy day, okay, could have UV radiation. So be sure to look for sunglasses that block 99 to 100% of both UVA, okay, and UVA radiation. Sunglasses, safety glasses, and goggles, please use them to protect your eyes when you're doing certain activities like playing sport, construction, and doing some home repairs. Looking at computer for a long time can tire your eyes. So you guys been looking at it for more than 20 minutes. So you know what I want you to do now? Move your eyesight from the computer somewhere else, and we'll come back in 20 seconds. Ready? Move it. Look somewhere else. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. 20 seconds. Move it back. Do that throughout the day. Give your eyes a rest. If you don't have the opportunity to just fully get up, because maybe you'll be at work, but remove your eyes from the computer and give it that rest. Again, always wash your hands before putting on or taking off contacts, and disinfect the contacts and replace them regularly. If not, use disposable. Now, to address challenges commonly faced by people living with type 2 diabetes, the American Diabetes Association created, and hold on, because I'll give you a break in a minute, created the Ask Me experts, and that is open. I mean, you can actually ask questions live for this. Okay, they have their time frames that they listed on their website. There's even a calling number that you can utilize. You can register, but if you happen to miss an event, you can watch events. You can watch past ones by just clicking. You go, you look at it, blah blah blah, you click. I actually looked at this particular one. What does an eye exam look like? I picked that one. This is what it gave me. I downloaded it, because you can download it too, or you can tweet it, or or you can email it to people. But I click play. It is an hour podcast, so you can listen to it at your earliest convenience. Now, because there's a lot of resources at the website, remember that if you share any of the information that they provide, if you don't mind doing hashtag ADA wellness, that would be greatly appreciated. Okay. Now, for a recently diagnosed person with type 2 diabetes, this can come as a shock, leaving them frustrated, confused, and needing help navigating the diabetes journey. Well, guess what? The American Diabetes Association has a Living with Type 2 Diabetes program, and they provide a lot of things. I know you can't really see it, but this is the email that I received, and it's easy. You can enroll by just clicking enroll. You can enroll in English or in Spanish, and this is all you get. Let me tell you all you get, okay? So you get 12 months free program. It's available, I said, in English, okay? It helps you control. You get 6 booklets. This is what the booklets are going to include: food and nutrition, stress and emotion, physical activity, preventing diabetes complications, staying on track. And again, you see it right here. You get an email. Today's I just got my email for this month. And I haven't read it yet, but last month when I developed this training, it was managing high blood pressure, and I thought it was so perfect that I was able to go ahead and get into and read this and get into their website and learn a little bit more about their type 2 diabetes program. Let's take a 5-minute let's take a 3-minute break. Then we're going to go into our Q&A section of our program. So bathroom, soda, no soda, sorry, scratch that from the recording. No soda. Water. I don't know why I said that, but yes, water. My bad. I have water here. I always fill it with water. So, and don't hang up. Just stay with us for the Q&A session, okay? And thank you for all of you staying with us throughout the entire training. I really do appreciate that. I'm going to give 2 more minutes for those that need to go get water, maybe have a potty break, that come back, and then we'll enter our last few slides, and then definitely a Q&A session. Just one more minute and we will come back. Oh, wow. There's been quite a bit of information in the chat. I like it. I like it. Oops, somebody needs to come in, so I'm going to admit them. Somebody accidentally must have dropped off. You know, connectivity issue happens all the time. All righty, so yeah, we still got a few more, one more minute, and then we will retake. All righty, so we're back. We are back. I want to be precise, you know. I'm kind of a, there you go, precise. There we go. So all righty, there's some resources if you ever wanted to know where all this information came from. Again, all of the resources from the ADA, of course. You can see here, you know, American Heart, CDC, NACHW. So all are great resources for this training. And now, you know me, I'm going to pick somebody, right? So I'm like, I'm going to pick somebody for the next thing. Okay, who's ready? Here we go. Here we go. Here we go. All righty. Miss Fox, how you doing today? I see you. You're looking so cute. There you go. Are you ready to play a game? That's okay. I wait until you come from unmute. It's okay. I can.
Hello?
No? Okay.
Hello?
Yes.
Is it Fox or Spots?
No, Fox. Fox. Got
Oh,
it. Miss
okay.
Fox. It's you. Great. I'm glad you're in. Are you ready?
Yes.
Okay, so here we go. Eat me as part of your healthy living routine. And I'm going to give you only 5 chances to pick any of the letters on the top. You tell me, I click it. Okay, guys, we're going to have fun because it's the end of our training. So what you got? Give me.
C.
C, got it. Okay.
A.
An A. Okay. We got 3 more.
A R.
An R. Okay. I'm looking at the R. You got 2 more.
OT. Marla.
OT. Okay, come on. Spell it for me. And then tomato. Well, thank you. Thank you for playing Guess the Word for us. Hey, I gotta throw something fun in there. What can I tell you? All righty. So now so we have come to the end of our presentation. It's now time to answer any questions. But before we begin the questions, I would like to take a moment to recognize 2 agencies that have made this training possible. Let's give it a virtual round of applause to the American Diabetes Association and the National Association of Community Health Workers for putting this training together. Without agencies like this investing in our communities, we couldn't make a healthier tomorrow for our families possible. Okay. And on behalf of HealthBridge for You, which is the company I represent, I thank you for the opportunity to have been your facilitator in this training today. And now we're open to questions. And I'm going to stop sharing because we'll be open to questions. Hey, look at all your faces. Yay, I can see you again. I was seeing only a few people. So I was picking on you because that's all I could see. All righty. What we got? I'm going to go to the chat, see what we got there. All righty, here we go. I'm sorry. I know we lost some people, but you know, some people might have had to log off because they had to, you know, work and other stuff. So anybody, questions? Thank you. Great information. Great. Okay. All righty. Okay. And now, since I still got a few more minutes, you can still ask questions, but I want to give the mic back to Aurora. She got a few things she needs to say and some reminders. Thank you, guys.
Thank you, Mercedes.
Thank
So
you.
just a couple of reminders. I know people have asked. So later today or this week, I'm going to send you Mercedes slides and the recording and the post-presentation survey out to email to everyone who registered, so you guys can have that both for your review and also to share widely. I've been throwing the post-presentation survey in the chat. That's what we're going to use to do your certificates and also do the raffle for our gift cards. Very exciting. And I will also send out the links that I talked about at the beginning of the presentation. Thank you so much, Mercedes. You really made this happen, and we really appreciate your energy and your expertise. I always love getting to see you present. But now I know there are some questions that I want to give some time to. So I will hand the floor out to our participants to see if anyone has any questions. Feel free to either throw them in the chat or raise your hand, come off the mic, and you can ask Mercedes.
I think you mentioned that if you're fasting, like if your stomach is empty and you drink alcohol, your blood sugar will drop. Is that what I understood?
Yes, that's not what I said. That's what is listed from the sources, the American Diabetes Association. Yes. So even a person like me having diabetes, and again, this is based on a person having diabetes. In my case, you know, if I wanted to do rum and Coke, what do I normally go for? That a person would have gone for, right? They would go for a diet. Well, you know, that could still be a problem for it. So remember, we have to have food every so often, right? A person with diabetes. That's why I schedule my meals. I don't know if some people does it, but I schedule my meals every 3 hours on the dot. And to help me do this, because I'm a busy person just like you guys, I put it on my cell phone and it goes off and I know it's time for a meal. And even if I'm on my desk, I find there's snacks here, nuts or simple things that I can have. Protein, I have protein shakes also that I have. Of course, I have a refrigerator inside my office, but that's beside the point, that I can have it cold. But I usually have snacks over here to you know, to kind of keep that blood sugar on pace. But yeah, and that's the common thing that happens a lot. People with diabetes tend to think, well, I'm not really consuming I'm really consuming a lot of alcohol. But remember, it's a different type of alcohol, or different type of sugar, I should say. Melanie, did that kind of, and again, my best resource for this, it's going to be the American Diabetes Association. Okay. They have so much information in the website and a lot of the handouts. When you get the PowerPoint, okay, each on the corner of the slides, it would say handout and it will give you a number. If you on your toolkit, you find that slide under the handout, you can see 5, 6, or 7 different handouts that will talk about that particular subject. Okay. We didn't put a whole lot on alcohol consumption because we really wanted to focus more on regular food that most people consume. But that was one of the things that, you know, when they reviewed it, that it was part of just making note that was said, at least to, you know, put the little light bulb on people, like it caught your eye, you know, kind of thing. Anybody else?
Thank you.
No, but I
Thank
love the
you.
fact that you guys stayed. Yeah, I mean, you stick to the end. I love it. Anybody else? Other than why I talk so fast? Sorry, it's a Cuban thing. Do you guys remember Ricky Ricardo? That his A's were, I don't know, sometimes half of the things you couldn't understand. So I do apologize for that. Sometimes I have problems with yellow and yellow. I don't know which yellow I'm talking about, gelatin or the color yellow, because my English rolls off. I'm better in Espanol. And my last name is Cruz, like Celia Cruz, so I can say azúcar. And I dance and mean salsa. I don't know how to make salsa well, but I sure dance it. So keeps me upbeat. And yes, with my strokes, I am very tired all the time, and I do have secondary damages, but it's my personality that keeps me upbeat. So have a positive outlook. Get up in the morning and say, yay, I'm above ground. It's a good day, even if you have circumstances throughout the day. But remember, you're alive, and that's a plus right there.
That's funny that you say that, because my grandmother was 100 years old. She lived to be almost 102. And
Oh.
every day she'd look at the obituaries first. And I'm like,
Why?
"Ma'am, what are you doing?" She's like, "I'm just checking to make sure I'm not in here. If I'm not in here, it's going to be a good day."
Yes, actually, you know, positivism actually helps you have a good day,
Brain.
and it also
They give
helps you.
endorphins.
Yeah, because it's like, it's a good day. You know, I used to walk now. True story. I used to walk in my Dallas office when I went to the office. Good morning, you know, good morning, Vietnam with Robert Bullions. I used to walk in and say, good morning. What's so good? Hey, I'm alive. It's a good day. Come
You're
on, guys.
above ground. It's another day.
Yeah, so I just love sharing joy and positivism out in the world, because it does make people around you drawn to you instead of repelled by you.
Yeah.
Draw people to you, don't repel them. Okay.
And you know what?
Mercedes,
Yes.
Free.
Question.
you are just a totally amazing facilitator. I have never been on a Zoom since COVID and heard anyone with such awesome spirit. You are just simply amazing, and all the information that you've given us. I will take that and teach to my patients. This is Gloria, counsel with Community Health Worker 2 with Novant Healthcare. But you are just, keep that personality and that attitude, because we want to listen. We want to hear you when you speak that way. So you are just simply amazing.
Thank you. Thank you. And yes, I believe somebody put a comment and it kind of rolled already, but I want to get it back to it. And I think it was Miss Reed. Yes, I totally agree with you. That's why, you know, we have to be very careful on what we tell, especially, you know, alcohol, substance abuse with medication. As a matter of fact, remember I mentioned that I also have other that I have had other classes. One of the classes that I teach to our Hispanic is we want to do chamomile tea for everything, right? And ginkgo biloba, if you all this supplemental that can have adverse effect on our medications, right? They can either null them completely, so they're ineffective, or they have negative effects to it. So again, that's why I do the disclaimer at the beginning. Make sure that we're talking to a professional about this, because we're individuals. The stage of diabetes that I'm in, it's totally different than a new person. I've been a person with diabetes since 2003, with calcification, with strokes. So definitely who I am is totally different than the next person. That's why we kind of give guidelines, but the best advice, talk to your doctor. And Georgia, I see your hand raised. Yes.
Yes, ma'am. Actually, you just kind of said it. I was just going to ask if there was any one piece of advice or anything in dealing with people with diabetes and other chronic health conditions. Is there anything that you would recommend that we as community health workers ask, or, you know, just keep in mind as we're dealing with these individuals? Sorry about the kids in the background.
No, that's fine. That's fine. You have what I want. Okay. Honestly, you see that craziness in the background? That's okay. I've been an empty nest for a long time. So I'm like, nobody's here. I want somebody screaming in the background. I kind of miss it. But then you say, when you have it, you don't want it. Okay, this is my best take, and I'm going to be straight up honest. I'm a person that is transparent as can be. Okay. We lost something. Everyone that is dealing with a medical condition, especially diabetes that causes depression, my strokes that cause depression, we are losing a little bit of ourselves every single day. So if we're mad at you, it's not you we're mad at the disease. We're mad sometimes at ourselves, because life has become a little bit boring, I should say, and I'm positive, but like I said, we have to juggle the days we're sick. We have to juggle the foods we got to look at people doing this and doing that. Again, if you have patience, if you have empathy, if you're there to listen, okay, and really ask us how we're doing. Don't say how you're doing and then go about your business. Really care. That's what I appreciate most in people that are my healthcare team. And yes, I get emotional because I really love that question. What can you do? I mean, you can talk about the facts and you can talk about the treatment and stuff, but the human element that goes so far in understanding and helping me through my journey. Joyce, I see you raise your hand. No. Oh, okay. All righty. Well, we're about a minute away to closing. And believe it or not, Mercedes goes from one thing to another. I run a team of 10 employees, and at 4:05, they're scheduled to meet with me, but I am more than willing. We got about a minute to answer any question. Joyce, I'm still available. If you can unmute and ask your question. Anybody else? Oh, Carol, you're on mute. I see you, but I can't hear you. There you go. Nope.
I have a client that takes vinegar for lowering their blood pressure. They stated to me that before. Does that really work, or is that a great suggestion for them? If
you know what I have learned a long time ago is what may work for one person may not work for another person. So I don't auto suggest. For example, I do have a certification in herbalism. Okay. But that is in a context where I can only trust a person to share knowledge about that if they're going to share with the doctor. But I find out that sometimes they don't even share that because there's a lot more components that go into the health of a person than just a single ingredient that they're doing, right? So again, I've been a person with diabetes since 2003. How much damage and blood pressure, how much damage do you think I had before I took control on January 6th of 2012? And I've been teaching for a long time. How much damage do you think I did? So again, maybe it does work, maybe it doesn't work. But again, I am a true believer of bringing the person to the doctor, although I do take herbs on it, but I tell my doctor that I'm doing it. So make sure he's not, my medication is not counteracting on some of the stuff that he's giving me. Okay. So my best advice, always talk to the doctor, but don't ever tell the person that doesn't work. Okay. Because you just close yourself to that person ever listening to me. You say, okay, well, I understand that's been helping it. Have you already talked to your doctor? And I suggest, you kind of look at everything you're taking or doing and share that with your doctor. Okay.
Okay. Thank you.
Thank you. All righty. Well, if there's no more questions, I do appreciate you being here. Thank you so much. We had over 283 people on the call. I know about an hour and a half into it, we lost a few. We started losing, but again, I understand, it is a 2-hour training. It's a big commitment, but I hope that those that stay behind found it, if informative, but at least did it, because I always do a call to action. Did it at least light the light bulb to say, am I doing enough for myself? Am I doing enough for the family? Am I sharing enough? Do I have enough resources in my toolkit as a CHW to assist our community? Because at the end, I'm going to be honest, I know I'm going to lose the fight one day, but just last year, I trained 629 community health workers, okay? And this year, I will be graduating some more brand new. So to the field, Remember, 6 months, 160 hours. So, and I love the fact that I was able to share this material with 283 of them, because it was 85, but Aurora and me count too. So that made it 285. So again, I do thank you so much for being here. Reach out to us, reach out to Aurora, and then give us some feedback. Let us know if you use this. Send us an email. Hey, I was able to use this. I used that handout, because we like to know what impact we're making. And if you're at Texas CHW, let me know. Send us an email. Let me know, because I do have in-person training and I would like to meet you in person. And I travel all around Texas teaching. Okay. I got it signed off, but I love the fact that you allow me to be here. Somebody was going to talk. I don't want to sign off. I got 1 more minute before I got to log into my students, to my employees.
Do virtual
Thank
training,
you.
Mercedes.
Yes, yes, we as a matter of fact, I think Aurora, we're working in future things to create new programs, right? And updates. So be on the lookout. NACHW's got some great things coming. Okay.
Definitely would be interested in doing that training session.
Yeah, so definitely let us know. We want to do things bigger and better, right? Each time, because technology gets better and information gets better. And as American Diabetes puts more information up there, we'll update our PowerPoint, we'll bring you some new handouts, and and we'll do it in a way that we have fun. It doesn't have to be, hello, hi there, how are you? No, we're going to be upbeat and very transparent and be real, because I live with this disease every single day. Okay, guys, love you from Texas. Take care. And remember, stay healthy, my friends. Okay, you can't fight a disease you do not fully understand. So fight, learn and live. Bye.
Bye.
Bye, Aurora.
Adios, amiga.
Adios, de Texas. I'll catch you with you later, Aurora.
Bye. Thank you.
Thanks.
Thank you.
Bye.